No problem, no problem at all. Thank you very much for coming to speak today.
My pleasure.
Um, so please just tell us about your journey and how you got to where you are now.
All right. So I think looking over some of the questions for today, I started with an interest in medicine from the age of 3. I am in a medical family. My father was an orthopedist, my grandfather a general practitioner, my mom a registered nurse, my paternal uncle is a psychiatrist. So medicine kind of came naturally to me. And as an aside, my brother is a transplant surgeon, and I ended up being a neurologist. So it was kind of inborn, and it may also fall to my offspring to follow in our footsteps. But in any event, so I was kind of on a trajectory. Personally, I got motivated, I would say, in 8th grade to go into medicine, and my entire focus up until and after getting into medicine was just to achieve that. So it started early for me, and I'd like to think that it continues on. My quest for knowledge and to help people continues on to this day. So I went to Lafayette College in Easton, Pennsylvania, and then for medical school, Temple University School of Medicine. And the question was, why did I go to those places? And for a couple things. One is Lafayette, I think, is an excellent institution, had an excellent pre-med program. My brother preceded me, and I knew it was going to get me where I wanted to go, and it was the right size fit for me with regard to student-faculty ratio and courses of interest. And I think it just had everything that I wanted. And then because I was successful there, I applied for medical school and got into several institutions. But I'm a legacy at Temple University School of Medicine. My grandfather graduated in the class of 1925, which was at that time an evening medical school, so they went to school at night. And then my father graduated class of 1955, and my brother entered 3 years before I did, and so it was a good fit. And so what's nice about Temple is that it's in a major medical area. I think there were 4 or 5 different medical schools there, so you could mix with other students, but also had real focus on clinical medicine, which was my initial interest. I wanted to take care of patients. And so much like I think the prior speaker, there was multiple rotations during school, and subsequently where I thought I was going to go, which was orthopedics, I decided against doing that and ended up loving neurology, and ended up going to internship and residency with a focus in neurology. One thing I would say, a little bit of a detour, is that right at the time when you have to select a specialty, I was undecided. So between graduation from medical school and entering an internship, which are usually one right after the other, I took a year and did a pediatric orthopedic research fellowship, during which actually it cemented my interest in neurology because I did spinal cord trauma research during that fellowship. So I did my internship at University of Pennsylvania Presbyterian Hospital and really loved that experience, and then did my residency at Thomas Jefferson University Hospital, which is also in Philadelphia, and got an incredible neurology clinical experience and also some research experience, which led me to get my fellowship, which was here at what was called New England Medical Center, which is now Tufts Medical Center, the major teaching hospital for Tufts University School of Medicine. And then after I finished my fellowship in neuromuscular disease, they asked me to stay on, and I was an attending physician there where I ran the neuromuscular clinic and the MS center for nearly 20 years. And then I got my second career. So after doing clinical neurology and treating patients one-on-one for nearly 20 years, an opportunity came up to enter into the pharmaceutical industry. And I was at a point in my career where it had been like, been there, done that, was looking for a new challenge. And because of where I was in my career and my life and the opportunity, I entered in as a medical director at Sanofi Genzyme, looking after one of their marketed MS products. And then subsequently, because of different opportunities, I've gradually climbed the ladder there to a point where I'm in my current role, which is head of North America Neurology Medical. So we are at this time not only looking after MS patients through 2 marketed MS products, but also we're expanding into different areas of neurology. And I can tell the folks on the webinar today that while I enjoyed treating patients one-on-one, this is also fulfilling because now I get to treat thousands of patients at once. So what else would you like to know?
Awesome. Thank you for sharing. We have quite a few questions in the chat here. First question here is, how does your MD help in industry as opposed to a typical PhD?
So I think a PhD it is possible to still do many of the things that I'm doing with a PhD. But the one part that's missing, and I think that the company appreciates about me, is the fact that I do have that clinical experience. PhDs typically, except for maybe a clinical psychologist, don't typically have hands-on patient care, whereas I do, and I had a good run with regard to treating patients for that couple of decades. So I bring that to the role, and one of the things as part of my job in medical is to interact with what we call key opinion leaders, KOLs, or HCPs, healthcare providers. So anything they want to know about our products, or if they're interested in collaborating with research, they talk with folks in medical. And what I can or have found in my role is one of the things they appreciate is when they're having a important scientific discussion, that they know that the person who they're talking to has actually had clinical experience and knows exactly what it is they're going through. And I think that through my prior clinical practice in academia, I have that experience which they can relate to and which I can relate to in there about what they're going through.
Wonderful, wonderful. We have another question here as well. What was the most difficult part of your journey in really the whole medical field?
Yeah, I would say that's a really good question. The most difficult part of practicing, I would say first practicing medicine, and the second thing is making sure that we do as much right as possible as we can for patients. I mean, part of the Hippocratic Oath, of course, is do no harm. And that's one of the key things I wanted to make sure in my career that I didn't do any harm. And that requires constant vigilance. And so it is a significant commitment. And I would say that if that's not a commitment that one is willing to do, they may want to think about a different aspect of medicine. But that always, for me, and even in my current role, we want to do what's best so that we help our patients and in no way make the situation worse for them. So it's a constant challenge.
That's very interesting. Thank you for that insight. We have another question here in the chat as well, asking, what exactly do you think would be best, or what did you look for in a medical school? And or you mentioned what you look for in a medical school, but what do you think is like the optimal medical school conditions for somebody just entering the field, more undecided, more just wanting to go, who's still figuring it all out?
I think the most important thing is when choosing a medical school is one in which allows medical students and the residents some capacity to actually care for the patients. There are medical schools in which, because of the medical legal aspect of things, there's a little bit of hands off, like medical students kind of watch and the residents start to make decisions, and as they get further along, they, as long as they are found to be make good clinical decisions, then they're given more and more responsibility. It's not to say that somebody, who has no experience should be thrown at the wolves, but it's certainly one that encourages the involvement of the medical student. So, for example, one of the things that was nice about Temple is that there are many times where you have to, unfortunately, do some invasive things like start IVs or put in what's called a central venous catheter, or do a spinal tap or lumbar puncture. And there are schools where that's or programs that's kept to the residents. And while you have a resident or an intern watching medical students do it, the one thing that was nice about my experience was that I actually got to do those things. And so I know that other schools allow or don't allow as much involvement. So again, it's all supervised, but it's a level of when you start to introduce or allow students to really get hands-on and try to help patients with different things.
That's very interesting. We have another question here in the chat as well, asking how specifically did your profession change during the COVID-19 pandemic, and how is the research being done now?
It's a great question. I am entirely virtual now, and I communicate with my team throughout the day, all virtually. I haven't been to my office in a year. And so how has it changed? In a couple, like a beneficial way and perhaps in somewhat of a injurious way. So the beneficial way is that because of the ease to which you can hop on a Zoom call or a webinar such as this, we can actually save time and save clinicians time by having Zoom calls with them to try to answer their medical questions, or if they're having a problem, if they're part of a research study, that we can quickly, rather than travel there, you can just hop on a Zoom call and hopefully work with them to try to figure out the problem. The downside of Zoom is the lack of personal contact. And I mean that some of the spontaneity where like in the office for us, where you could have you could go to lunch and you could have a conversation, and that's where some of the ideas gel, and you can move things forward that way. A lot of that's missing, and the other portion of that is because you can't be with your team. It's hard because in my role, I also mentor the folks that report to me, who I manage. And it's a little more challenging to do that on via Zoom because while the camera captures some emotion, you can't see a lot of body language, and it's a little hard to do team building that way as well. So
that's definitely an important insight, especially into how critical that really in-person interaction is in the medical field.
Well, definitely, from understanding what is involved in patient care, even though I think the lay press talks about the wonders of telemedicine, it's one thing if you can take the history, as we call it, in other words, hearing what the patient's issues are, what they call the complaints, and trying to get the history. But medicine still requires laying on of hands, and it's very tough for me to do that through the camera here. And that would be true, of course, people in clinical practice.
Certainly, certainly. We have another question here. Why did you take specific interest in motion disorders under the field of neurology?
Thanks for the question. Technically, my interest is neuromuscular disorders, and that's a little different than movement disorders, and I'll kind of separate this. So neurology is a specialty, and then there are subspecialties within neurology. One of them is stroke. One of them is epilepsy, so that's having to do with patients who have seizures. One is neuroimmunology, which is a little bit blurred, and I'll explain that in a moment, but that's for people who have immunologic disorders. So their immune system, unfortunately, instead of attacking foreign invaders, for example, ends up attacking self, and it happens to be the neurologic system, so the central or peripheral nervous system. There's movement disorders, and when you think about the term movement disorder, that's disorders like Parkinson's disease, which is probably the biggest one, people with tremor. There's something called a benign essential tremor, Huntington's disease, which is a genetic disorder of movement. So that's that class, and then or that system. And then, so neuromuscular disorders, what that deals with is disorders primarily of the peripheral nervous system. So if you think about the nervous system has two parts. There's the central nervous system, which includes the brain and spinal cord. And then there's the peripheral nervous system, which is essentially the nerves that come out from the spinal cord and extend and control your muscles, but also supply your sensation. So they're nerves that go to the skin, etc. So why did I take an interest in that? I think it's mostly because there were the greatest number of treatments that I could actually make a difference, because a lot of the peripheral nervous system disorders are autoimmune in nature, and I can fix that, as opposed to Parkinson's disease. While we can treat Parkinson's disease, still it is symptomatic treatment. It's the same for epilepsy, like you control people's seizures, but it's really just controlling the symptoms. It's not fixing the cause. And it was my feeling that with neuromuscular medicine, with some disorders, with exception, I could actually affect treatment on that. Now, I also took care and ran the MS clinic, so multiple sclerosis, which is an autoimmune disorder of the central nervous system. But we now have 20 or more treatments for MS. And when I got into practice, we actually were just beginning to get those treatments. So we've actually made a difference for that group. And again, it has to do with the immune system. So really, though I have a neuromuscular training, I'm a neuroimmunologist. So I when I was in practice, I treated patients with central and peripheral immunologic disorders that affected the nervous system.
Wonderful. Thank you very much for sharing today and being on and helping us all out with this.
Absolutely. I don't know if our time is up, but I wish everybody good luck in their pursuit of medicine, and we need all of your help because we still have a lot of patients to care for.
Absolutely. Thank you very much.
Absolutely.
Okay. For our final presenter here, we have Alex Peruta. And Alex Peruta is a seasoned educational consultant, private school, college, and graduate school, and a master tutor as well. Armed with over 15 years of firsthand experience in college prep and rigorous climate of elite academic institutions, Alex has a unique insight into the top-tier academic study and admissions, both at secondary and university level. Graduating with honors from Williams College with degrees in biology, chemistry, and biochemistry, Alexandra went to work at Yale University School of Medicine, studying infectious diseases, and continued her graduate studies at Harvard University. With Alex's expert guidance, her students have successfully been admitted to over 500 top colleges and universities. Alex's extensive STEM background has also prepared for her to successfully mentor numerous students in their pursuit of STEM and pre-health careers. With over a decade of consulting and over 30,000 hours of tutoring and educational advising experience, Alex offers a unique approach to academic consulting that has aided hundreds of students in achieving their academic goals. Ladies and gentlemen, please welcome Alex Karuda.
Thank you so much for that. I'm going to switch over because I want to jump right into my presentation. So let me do that one second. I want to spend some time talking about how high school students can develop and enrich their interests in both medicine and healthcare, and how they can then take their passion for medicine and healthcare and show it during their college application process. So the first thing that I wanted to start with is how students can develop their interest early on and begin to show their interest in activities that they may participate in. There's a lot of ways for students to explore healthcare and medicine at the high school level, and I think there's a lot of ways that students aren't really quite aware of. I first wanted to start with an easy way to begin investigating healthcare and medicine, especially if you're a student that's heard about the topic, heard about the career, but are not really sure exactly what you'd want to do. So I wanted to discuss some online resources that I think would be a great place to start. One of those is a website called healthcarepathway.com. I really like this resource because it goes through many different careers that fall under healthcare and what these careers are about, as well as how to potentially work towards these careers. So I think a lot of students, when they think of medicine or healthcare, they are thinking of going to med school and becoming a doctor and maybe a physician in an emergency room or a surgeon. And those are absolutely healthcare careers, but there are so many others. There's dentists, there's nurses, there's lab technicians. There's a lot of options. So I think having a resource to explain the different options available is a great way to start. And then beyond that, I really feel like students can explore their interests further through things like TED Talks, podcasts, and newspapers. There are plenty of these that are oriented towards medicine or healthcare, or do specials on these topics. When a student has explored initially things within healthcare, I think the next logical step can be to seek out potentially some online classes. This will allow a student to explore some of the topics associated with medicine in more depth and potentially be exposed to topics that they wouldn't be able to take in a high school course. And there are some different levels to these types of online classes. There are ones that are non-credit that may be anywhere from a week to a few weeks long and take, maybe 10 or 20 hours to complete the entire course. There are credit courses that could be 6, 7 weeks, or potentially even an entire semester. And then there's also courses that are certificate-based. So a student is not going to get credit particularly at the high school or college level for taking the course, but if they complete it, and typically if they perform to a certain degree on any assessments that are given within the online course, they can get a certificate for it, showing their completion and their proficiency in whatever the topic is. And there's a few websites that I particularly like to reference to students that I think are great places to find online classes, which are edX and Coursera. These are two online platforms where many professors from different universities and colleges all across the country and frankly all over the world will put up online courses. And they're oftentimes classes that are actually offered in person at those colleges and universities as well. There are many that are oriented towards healthcare, medicine, or some of those fundamental topics that a student needs to understand to then go on to do healthcare and medicine, like biology, anatomy and physiology, potentially even chemistry as well. There are some colleges and universities that directly have their own online classes as well, oriented towards different topics. Beyond online courses, a student can, of course, think about their high school course selection and how they can develop potentially their interest in healthcare further, or at least create a strong foundation for studying healthcare outside of school or at the college level. So a few things that I tell students to take into consideration is I always advise students when thinking about their high school coursework to plan early. Some high school courses, especially ones that a student might take as an 11th or 12th grader, have prerequisites to them. Certain classes that you're required to take before you can take that upper level course. If you don't plan out things early enough, sometimes you won't have that base level course you need to take the more advanced course later on. And so I really advise students to sort of have a plan mapped out for, of course, what they plan on taking the next year, but potentially the year and the year after that, depending on what point in high school they're in. This can, of course, be altered as they go through, but at least having that framework, I think, is quite important. When thinking about what actual courses to potentially take that could some way be connected to healthcare, I tell students there are many courses that could be connected, but to potentially consider some elective STEM classes. STEM is a lot of it creates the foundation for pre-med work at the undergraduate level. So a student potentially take a course, something like anatomy and physiology, which would be directly related to what they would study as an undergraduate pursuing pre-med. I also tell students that if they feel like STEM is an area that they are strong in, to consider taking an AP science course, by the time they graduate, if the level is appropriate and fits them. I say that because there's no expectation that a student is necessarily going to graduate from high school and have taken an AP in every subject. But if there's a subject that they're interested in, they're excited about, that would potentially tie to their interest in healthcare and medicine, it may make sense for the student to challenge themselves in that type of subject, in that coursework. And the other thing that I express to students is, sometimes high schools don't have every course you might be interested in, or you may not be able to get into a course because it's full or it doesn't work with scheduling. I remind students that there are ways to seek knowledge and gain more information outside of the classroom in school. So one way that students can really seek outside opportunities is to consider looking for a health mentor. And the concept here is that healthcare, pre-med, going down the medical route, it's a very complex process. There's a lot of different things to study. There's many different career paths. And I think that because there are so many options, it's great to be able to speak to one or honestly multiple people who have taken different paths in healthcare. There are a lot of different options for who might be able to sort of be a health mentor. I think obviously a healthcare professional is one of them. Also, there are lots of medical researchers who have their MD and do research in clinical trials or in a medical setting as well, which is another option within medicine and healthcare. Or potentially even a professor or an instructor for different health professions. These are people that are already training the next generation. They can be a great resource, give you a better understanding about what the career path is like, and things that you should maybe consider as a high school student that you wouldn't normally. Now, I think that once a student does their initial exploration, maybe sort of in an online format through resources, classes, has taken foundational courses in school that connect to medicine and healthcare, the next step, the next level after that is to really gain healthcare experience in some way for a few reasons. And I want to discuss why I think these hands-on experiences are so important. The first thing is it really helps a student understand if healthcare and medicine is a route they really want to pursue, right? I think a lot of students in high school feel they may want to go into medicine because they want to help people, which is a great reason, right? But there are many careers, there are many professions that a student can be involved in that will allow them to help people in different ways, not just healthcare. And medicine comes along with a lot of challenges, a lot of stresses, and some really unique environments. So I think having the opportunity to gain some hands-on experience in a shadowing or internship setting can really give a student a better sense of what this potential career would be like, more so than they could get from an online course or frankly, even just talking to someone else who's engaged in healthcare. And for example, a student might think they're interested in clinical research or medical research, sort of the lab bench side of healthcare. Research is challenging. Sometimes it can be very isolating. And there are certain traits that are really needed to be a successful scientific researcher. And if a student is able to have an experience potentially in a lab, they may get a strong sense of if they really enjoy this type of work or if they not. And even if a student feels like they didn't enjoy the experience, it's absolutely worthwhile experience to have had because you learn from it. You can try something else now. The other reason I think gaining hands-on experience is so important is that colleges really want to see that students have explored their interests outside of the classroom. And the reason is when a student indicates on an application to a college that they're interested in a particular area of study, definitely, pre-medicine, healthcare, or even another academic area, colleges know that these academic subjects can be very challenging. And they really want to see that students have had some exposure to them sort of outside of the classroom, and they feel strongly about what they want to do. So I wanted to talk about a few of the different ways that a student can gain really sort of experience within medicine and healthcare. I think the first avenue is school-associated activities. So a lot of schools will have, pre-med clubs or health clubs or even science teams that a student can engage in, which I think is great because you're able to interact with peers, other individuals who share your passion for whatever the subject happens to be. You can gain a lot of knowledge and information really from your peers as well. And typically these clubs also have an advisor that's qualified in the subject or related subject to the club's topic. And it's a good way to also be involved in the school community. And if you find that your school doesn't have a club for something you're looking for, one thing you can really consider if you're motivated is establishing it yourself, right? So I've had a student in the past who was very interested, particularly in veterinary medicine, which is definitely one route within healthcare medicine. And his school did not have a veterinary club of any sort, an animal science club. They had a pre-med club, but the pre-med club very much focused on medicine as it is related to humans, not necessarily animals. So he founded at his school a veterinary club, and he couldn't believe that when he set up the club and put out the notification, how many students signed up and came to the first meeting. And he realized there was this entire group of people that are also very dedicated to the idea of animal science and potentially becoming veterinarians in the future. So I wanted to delve a little more into the concept of doing a leadership project because I think leadership projects are a fantastic way for a student to have hands-on experience in whatever area they're interested in. So leadership projects are typically when a student organizes something, whether it's an event, whether it's a large research project, whether it's the creation of an organization or club, and they are orchestrating the majority of it themselves. They are taking the lead. And this shows to colleges, if a student were to talk about a leadership project, how mature a student is, how responsible they are. And conducting a leadership project really allows students to develop a lot of skills that they may not have practiced before outside of the topic. So for that example of that student who formed the veterinary club, yes, they were able to learn more about the veterinary profession and animal sciences as the club went on and talked about different things. But that student had to recruit other club members, had to find an advisor and communicate with that person. They hosted events for the general public, so they had to work on social media and promoting that. So my student also created a website and was able to build a lot of skills that they didn't already have tied to their leadership project. And so I gave a few other examples of leadership projects, like potentially something like organizing a blood drive or even hosting a healthcare workshop. I find that colleges really like to see that students have engaged in leadership in high school because colleges are trying to have an understanding of how a student might contribute to the college community when they get there. So if a student shows leadership or leadership potential, that's a really great sign for that college. And there's so many different forms of leadership and ways to carry out leadership projects. Students really have a lot of options. So beyond school-associated activities and potentially leadership projects to gain really experience in healthcare and medicine, there are absolutely opportunities for summer programs. So there are really sort of two categories, I would say, of summer programs. There are summer programs that are more broad and exploratory. We would refer to these as more liberal arts style summer programs. They tend to be shorter. You may be taking classes in more than one area and really just gaining an overall exposure and foundation to many subjects. And I gave a few examples here. There are also healthcare focused summer programs. Those tend to be more in-depth. Oftentimes they're a little bit longer programs, maybe 3-4 weeks, and they usually focus on much more of a niche topic. I think they're both great opportunities. I'll have a lot of students that start with more of a liberal arts style summer program where maybe one of the things they're doing is connected to, biology or anatomy or medical ethics, for example, another type of course that might connect. And then they might progress in a future summer to a very healthcare focused program where all of the classes they take and all of the activities they do are oriented around medicine. And colleges absolutely do look at what students do with their summers. They want students, of course, to have a break, and they understand that students might be doing other things like have a job or volunteering, which is fantastic. But I think if students have the opportunity to spend at least a part of their summer exploring their academic interests and their potential career interests, that is absolutely something that colleges like to see as well. So the final type of summer program is really summer courses that a student can take for undergraduate credit. And I talk about this separately because it's really on a very different level from the first two programs I discussed. If a student takes a summer course for undergraduate credit, it's usually in a very specific topic area. And colleges really appreciate seeing this if a student decides to go this route, because a student is going to take a class for undergraduate credit at a college or university. It could be online, could be in person. And usually that class also has actual undergraduate college students in it. So the rigor level is quite high and oftentimes viewed as higher than AP credit, which is typically the highest level class that a student can take in most high schools. And so because of this, students are really able to delve deeply into a passion that they have, take a challenging course, really show their ability in that course as well, and show their ability to the colleges that they can handle a high level of rigor. I mean, to the extent that on the Common App, one of the main application systems, there is a question was added a few years ago where students can list the summer programs and courses that they take associated with colleges and universities, and they can even submit the transcripts for that work that they do. The only thing that I remind students is these classes are serious. They do take dedication and time, and you need to choose appropriately what class you take and how much else you have on your plate at that time that you're taking the course, so you can really make sure to balance everything. And I say as a resource, if you're trying to look for courses for undergraduate credit, there are plenty of major universities and colleges that do offer these classes, but there are absolutely also local, regional, and community colleges as well that offer classes pretty much every season. So I would say one of the sort of highest levels of medicine and healthcare experiences are one-on-one experiences. And these experiences are usually put into a few categories. There's shadowing, really, there's volunteering, and there are different forms of internships. Shadowing opportunities tend to be situations where a student for maybe a day or 2 days, maybe a week, maybe 2 weeks, is going to basically follow around and observe someone in a particular field. This could be a nurse. This could be a radiology technician. This could be a primary care physician. This could be someone who's doing medical, lab bench research. This could be someone that's helping organize and manage different hospital departments, sort of more of the business side of healthcare. So there's really a lot of options to explore there. But the point is, it's usually more short-term, it's observation, and it's less actual work that the student is doing themselves. I think this is a great way to have some initial exposure to sort of a one-on-one healthcare experience. Beyond that, there's also volunteering options. So students in a lot of situations can volunteer in a hospital setting, they can volunteer in a nursing home, and now I'm seeing even more and more that some of these volunteer opportunities are also available online, where students can, for example, interact with nursing home residents in a virtual setting. Volunteering, I think, is a great thing to do overall. It shows a student's commitment to the community and to the greater good, but that volunteering can absolutely be oriented to a student's academic interests as well as career interests. And then finally, there are opportunities for internships where a student is really doing more hands-on work themselves. Now, lab internships are a major type of internship connected to healthcare and medicine specifically. And as far as lab internships are concerned, there are really options within the academic setting and within what we call private industry. So a student could be working in a medical school lab associated with a specific college or university, or they could be doing an internship at a company that's focused around healthcare. The biggest thing that I will say to students here for as far as securing internships is that there are programs that place students in internships, like the BU Rise program. And then there are internships where students are really self-initiating it. They're reaching out directly to certain professors or certain researchers because they're interested in the work that they're doing in their lab. As far as that's concerned, I have had much more success with my students in doing self-initiated internships, not just for actually securing the internship, but really what they got out of the experience. Because in a lot of the programs that place students in internships, sometimes you might be placed with another individual. There might be actually more than one student that's paired with that mentor. And in addition to that, those internships usually have a very set sort of time period and oftentimes even occur in the summer. Whereas self-initiated internships, oftentimes the student is the only one that's really doing the internship with that particular faculty member or mentor. And oftentimes, if the work is going well, if there's a strong relationship being formed, the student can sort of continue that work into the future. The one thing that I'll say to students about self-initiating internships is there really is a protocol to follow to have success in reaching out directly to researchers, faculty members at universities if you want to work with them. And the biggest thing I will say to start with is you really need to do your research. You need to understand what the lab is working on. You need to understand sort of the background of, maybe what health topic it connects to. You need to show interest in the previous work that they've done and show that you would really help them. You would be a benefit to their lab. Right? So students who just immediately reach out to someone and say, I'm interested in your work and I would like you to consider for me for an internship, it's not impossible that they'll get an internship, but it's less likely. But if a student does the research, talks with the professor and connects with them about what they're doing, what they've previously done, asks questions and builds a little bit of that relationship, oftentimes that potential mentor or faculty member really gets a different sense about the student and how capable they are and how dedicated they are as well. So I think something to keep in mind is no matter what kind of healthcare experiences you have, it's important to make the most of those experiences. So I have a lot of students that do some fantastic things within healthcare and medicine, and they don't necessarily show that later on down the road, which is something that's really important to remember. So I tell students as they go through and have these experiences to try to document what they've done, track the skills that they've learned from whatever experiences they've had, to really consider forming relationships with the people that are their mentors that are associated with these experiences, whether it's the advisor of their pre-med club at school, whether it's the researcher that they're interning with, right, or potentially the doctor that they're shadowing. I think that forming these relationships is quite important. And oftentimes this leads to a student having a more significant experience in the particular activity that they're doing. And that may lead to the student having sort of a substantial experience where they can have a publication, or they could potentially attend and present what they've learned or what they've worked on in a science or medical conference setting. So I absolutely tell students to consider submitting the work that they've done for review if they've had a substantial experience. So once a student has really developed this interest in medicine and healthcare and has explored it, sort of what's the next step, right? We really need to think about that. And the next step is to think about how this is going to pertain to the college search process, right? So I tell students, first of all, to keep an open mind. There are many different things that connect to medicine and healthcare. A student could be pre-med, pre-vet, pre-dental, or be on a research track. And there's other options as well. And what I remind students about all of these pre-options is that you can go to med school, you can go to vet school, you can go to dental school down the road and have majored in many, many different things. There is no pre-med major in college, right? So to make sure that when they're thinking about schools, they're really exploring their different interests and keeping an open mind about how they may be able to get from college into whatever graduate program or career they hope to have down the road. As long as a student takes the requirements needed to apply to these graduate schools, which is usually certain coursework and certain hands-on experiences, they are qualified to apply. So I have students who will major in more common sort of pre-med associated subjects like biology, but I've also frankly had students major in English and apply to medical school and be successful. So college is really a time for exploring your interests, and just because you want to go into healthcare and medicine doesn't mean you have to have a very specific major. If a student hopes to engage in research down the road from a particular perspective, then sometimes their major might more be directly oriented to what they hope to do in grad school and in research. So I think when considering the college search process, knowing that there are so many options, there's really two main types of schools. There are what we would call explorer schools and path schools. So explorer schools are ones in which a student just applies to the school overall, and they are considered for admission, based on their overall profile. And once the student gets there, the student has time to explore different options and then choose what they want to major in. So a lot of explorer schools would be considered liberal arts colleges, right? And I think that there's this misconception that liberal arts colleges are not the best place to engage in STEM work or healthcare or pre-med work. But some of these small liberal arts colleges are fantastic places to do that type of work and gain that type of experience because you can have great one-on-one relationships with professors and faculty members. Path schools are schools in which when you're in high school and you apply to college, you're applying to a specific major or a specific program. You're not applying to the school overall, so you're making a decision sooner. So this fit may be better for students who have really delved deep in high school, explored their interests to a great extent and feel very confident in what they want to study. You can go to either type of school and later go to a strong graduate program, whether it's medical program, dental program, veterinary program, or something else. Now, something else to consider is that at a lot of schools, you have these direct admit programs. So for certain types of interests, you're going to be applying to a specific program that has certain criteria for getting admitted, as well as certain criteria of what you need to accomplish in the typically 4 years or maybe longer that you're in that program. So some examples of those might be something like biomedical engineering, nursing, and dual degree programs. So dual degree programs are typically ones where you are admitted to this program and you get your undergraduate degree in 3 or 4 years, depending on how it's really set up. And then you are moving sort of directly on to typically another degree. So for example, a dual degree program might be where you get a BS, which is like a Bachelor of Science in some subjects, and then it leads into an MD, right? Or getting your medical degree. And these programs, because they're covering such a long period of time, they're very selective, and there's not a lot of them around the country. So I tell students that it is possible to have some of these types of dual degree programs on their list, but in order to be strongly considered, they really have to have had pretty significant experience in healthcare and medicine. And on top of that, they have to have really generally strong academic profiles, because there are so few programs around the country. There's by no means a requirement to do a dual degree program to get into medical school. The majority of people, the typical route is they get a 4-year undergraduate degree. They then will do whatever they need to do to prepare their applications, and then they will apply to med school, or vet school or dental school separately, not necessarily together. So when a student has really thought about the types of colleges that might be the right fit for them, thought about the types of programs that might be a good fit for them, and they've already explored their healthcare and medicine interests, it's important then to think about how they can leverage these interests and all these things that they've done in the actual college application process. And there's a lot of places to sort of work it in to that process that I don't think students consider. So I think initially one way to incorporate it into the application process is to show pre-med interest during the actual college search itself, before students actually even technically filled out the application, because colleges will start really tracking students and their interactions with schools. A lot of colleges do this from when a student signs up for a tour, an information session, or something like that. So there are absolutely STEM/pre-med or healthcare specific college tours at some schools that a student can engage in. Students might be able to connect with science or STEM professors at a college in an area that they're interested in. They may be able to sit in on a healthcare associated class, or they might be able to, of course, apply to a specific healthcare type of program, like nursing, for example. These are all ways to start showing this interest early. Beyond that, there are really places that a student can consider working in their experiences in medicine and healthcare into their main application. So this is commonly referred to as the Common App. The Common App is a system online that students can use to apply to multiple colleges and universities really at one time. The idea is to simplify things down and allow students to fill out their basic information in one place, submit that, and then submit a few separate pieces to the schools they're interested in. It's really about streamlining the process. A lot of schools are on the Common App or Common Application System. There are a few schools that aren't and use other application systems as well. But within the Common App, there is an activity section where a student in very short form, in very few words, 150 characters, explains the activities that they've engaged in, how much time they spent doing these activities, and sort of what was involved in doing the activities. This is a great place to talk about the online course you took at edX in medical ethics, or the summer program you participated in about neuroscience, or the shadowing experience you had with the veterinarian this past spring. There are so many things that can be included in this activity section. Anything that really isn't a student sitting in their normal sort of classes in school could really be deemed as an activity. There is also a section on the main part of the application called the additional information section. And this section is where students can really have 650 words to put whatever they'd like. And students use this area for different reasons, but I think that if a student has had a really meaningful research experience or shadowing experience or internship where, 150 character explanation, which is, maybe a sentence or two, isn't really enough, they can provide a further description in the additional information section. I also remind students that there is a section on the application that asks about the colleges and universities that a student has gone to and attended programs at, whether those are summer programs that aren't for credit or those are undergraduate courses for credit that a student took. And then finally, for some students, depending on how their main essay comes together, it may make sense that they reference a meaningful healthcare experience that they've had within their main application. Now, that being said, not every student who has a strong interest in pre-med and a strong pre-med profile talks about this in their main essay. But potentially, depending on what you've done, it may work well into a question. There are certain questions asking you about significant experiences you've had and potentially how it's altered your perspective about things. That may be true for a experience you had in medicine or healthcare throughout your time in high school. Besides the main part of the application, there are school-specific sections to the application as well. And some schools will allow students to upload a list of activities or resume where you can really provide further detail. And a lot of students ask me, well, how is this actually different from the activity section? And what I tell students is the resume allows you to really discuss the skills you've learned, as well as not only talk about what you actually did. Some schools will also include an additional document upload section where students can provide more information about activities that they've engaged in instead of calling it sort of a resume section. Most colleges and universities ask for what we call supplemental essays, questions that are specific to them. And I've given 3 of those sort of topics here. And for example, if a student is discussing an important activity, they might decide to talk about their veterinary shadowing experience. If they're talking about a potential major, they may decide to talk about neuroscience because they hope later on down the road to go to medical school and potentially their goal is to be a neurosurgeon. When a student is talking about why they want to attend a specific college, one point they might bring up is whether or not, and hopefully it is that they have it, the school has a strong pre-health, pre-med health career advising program, right? If they do research into that, that's absolutely something to look for, and that's something that can be mentioned about why a student has a strong interest in a school. These experiences can also be discussed oftentimes in interviews if a school has that as well, because they would have played a meaningful role in a student's, time in high school. And the last thing that I really like to emphasize as far as a student submitting application materials is that a student has the option to submit a portfolio. And a lot of my students think a portfolio is strictly for students who are interested in art or music, right? But portfolios can be considered by many other groups of students with other interests. So one that comes to mind for me is a healthcare portfolio. So I have students that put together sort of a well-organized PDF document that contains very pertinent information completely focused on their interests in healthcare and medicine, or potentially STEM if that's what the students' main interests are as well. And oftentimes this portfolio will contain things like an abstract of medical research they've done, a healthcare specific resume that talks about what courses they've taken connected to healthcare, talks about volunteer work that they've participated in, summer programs, right, internships, and potentially even this portfolio may be accompanied by a separate letter of recommendation from an advisor of their pre-med club, or maybe potentially the person they did an internship with. The one thing I'll say about putting together this portfolio, because it's a little bit different and there's a lot of components that can go into it, is this is most likely a time to seek professional guidance, to ask for some help about putting this together, to make sure you really have all the pieces and it comes across well and really shows your passion and your interest for medicine and healthcare. So thank you very, very much today for listening to my presentation. I know that we're about to get into Q&A, and I just wanted to let everyone know that if they have any specific questions that they feel like don't get answered today during the presentation, or that they feel are specific to them and they wouldn't necessarily want to ask to the general public, definitely feel free to reach out to me. I'm happy to have a 30-minute consult with anyone who attended the webinar today to talk over anything that relates to this presentation. So absolutely feel free to reach out to me.
Wonderful. Thank you, Alex, so much for sharing all this wonderful information with everybody here today. I'm sure everybody greatly appreciates it. We do have quite a few questions here in the chat for you. So I will just say first, do you know of any ways students can find shadowing opportunities, especially now in COVID times, where mostly everything is remote and online?
Absolutely. I completely understand that. So this has been an issue for the last, many months, almost the last year at this point. And what I do stress to students is there are absolutely virtual volunteer opportunities. And one example that I have of that is you may not really be able to be in a situation to have direct patient interaction in person, but I do know of specific programs, some hospitals, and a good number of nursing homes actually, that are allowing students to volunteer in a virtual setting to spend time with patients, with individuals that are associated with those organizations. So I think that's one great opportunity. I also remind people that, yes, this is a different time, but the sort of the leadership project we talked about, for example, or taking online courses may be another great way to subsidize at this moment if you can't have that true in-person experience. I will say, at least here where I am in the Boston area, I'm starting to see students have a few more opportunities potentially upcoming this summer for in-person. So I think there will be a change soon too.
That's wonderful. Thank you for sharing. We also have as well here, do you have any recommendations for a financial aid regarding these programs, or are there any ways to find any free summer programs for those who aren't able to afford the more costly ones?
Yeah, that's absolutely a great question. So first thing that I would say is there's definitely programming that is free or is potentially subsidized. So subsidized where there's an organization that's also paying partially for the cost. There are not as many of those, of course, as the full pay programs, if I'm being totally honest. But if you go and you search for summer program opportunities, they will usually clearly list if they have a financial aid opportunity. And sometimes that's followed by an additional piece to the application to be considered for that. So that's, one piece to consider when you're looking at them. But I would also say that obviously a lot of the online coursework like edX and Coursera are two places you can do that online work. It's a little bit different, but the majority of their courses, a very high percentage of them are free to take. And I would say also those experiences for volunteering and shadowing, which could be just as beneficial as doing a summer program, usually have no cost involved. And I've actually had students who are interning, for example, in a research lab, who've actually in the end done such great work, the researchers decided to keep them on and pay them as a job. So I think there's a lot of creative ways to think about that.
Definitely. We also have a question here in the chat asking on any specific summer courses you recommend.
Any specific summer courses? So I think if we're talking about courses, potentially whether they're for credit or not for credit, I think it depends on what part you are in sort of your journey of investigating medicine and healthcare. And I usually think about it as a progression. So if some of my students, when they first start out, are going to potentially attend a program that I said is more exploratory. So I know we have people on from all over, but I'll just, as an example, Brown University does like very liberal arts style summer programs where they're bringing together some really interesting topics. That might be a good fit for someone earlier on in the process. As far as what courses to take, if you get to the point where you're willing to do something for undergraduate credit, I think it's most interesting to think about courses you might not be able to take at your school. I think anatomy and physiology is a great example. Like, not a ton of high schools offer it. It's obviously very applicable to many parts of healthcare and medicine, no matter what career in that field you want to go into. And I have 100% had students take that type of coursework at a local college or even a larger university.
We have another follow-up question in the chat here, actually asking how to reach out to the nursing homes for those programs you mentioned earlier where the students can work with patients.
I think there is some variation there. I mean, I would say an email is always a great place to start. Make sure your email is put together well. You explain who you are, what grade you're in, you give a little bit of your background and your interest, and you see what the opportunities are available. Some nursing homes will list volunteer opportunities right on their website. Others won't, even though you can do them. So I think starting with an email to oftentimes the director of programs, a lot of them have that, is a great way to make that connection. And then they can make it clear to you what they do offer. Because some of these programs, you have to meet a certain age requirement or things like that. And you're really not going to know that until you contact the program. So honestly, I think starting with an email and giving a little bit of background is probably the best thing you could do.
Okay. We also have a question here in the chat asking how someone could find an internship if they have some trouble speaking English or if their English is not their first language.
Okay. So, well, of course, I would sort of assume that question is oriented to doing an internship where their primary language is English, right? And that a person that coming in may not have the strongest English skills. I think it's going to depend on the internship. Do I think it's possible? Yes. I think it depends. English proficiency, there's really a spectrum there, and it's something you have to be comfortable with. For example, in certain research labs where you have to know certain background information and topics in detail that you may not have studied, or you may have learned a lot about it in a different language, that might be more difficult. Where if it's an internship where you're sort of doing more general communication and requires less technical knowledge and technical vocab, that might be a little bit easier. I think trying something where you can volunteer first to work on improving your English skills and your communication would be a great place to start.
Thank you. Thank you for sharing. We also have a question here as well. You mentioned the PATH schools and the direct admit programs for students who are very heavily interested in medical school. This individual asks, if they end up changing their mind about their career or if their interests falter a little bit, how exactly could they adapt from that point if they're in one of those programs or if they're in a PATH school?
Right. So I think it's going to depend on the type of program you're in. And frankly, it's going to depend on the university, which as you hear me talk, that's something I'll say a lot. It really depends on the individual school and program. But I'd say overall, if a student is in a particular major, like for example, they're in the engineering school because they want to do biomedical engineering as their undergraduate, there's oftentimes opportunities to transfer into another department or another part of the same college. Right? That is absolutely an opportunity in many settings. As far as if you're in like a dual degree program, let's say a BS-MD program, it is possible. It's a little bit trickier because they have to sort of meld what you've already done in this program to what you would need to do in a typical undergraduate program to meet all the graduation requirements. And realistically, when they're choosing candidates for those types of programs, they're looking very seriously at them in the hopes of understanding, are they really committed? Do they understand what they're sort of getting themselves into? So it tends to be a little more difficult, but it's definitely doable. People do change their mind. It happens.
Certainly. And we have another question here as well. How can students sit in on the STEM and healthcare oriented classes, and how exactly would that work?
Right. That's a great question. So at some schools, it's built into the admissions office visit program, whether it's their virtual visit program or their in-person visit program. They will have the opportunity for students to sign up for certain courses that they've made available for prospective students to sit in on this class. That's a limited number of schools. So I tell students another option is it never hurts to ask. So I will have students contact an admissions office, say what they're interested in, that they're potentially coming to visit in person or potentially even online, and say if there's an opportunity. Sometimes even if it's not posted, a student can really still engage in that. Another option potentially is if a student has really explored a school and has looked at a certain department that they're interested in and there's certain faculty members, they can really directly email the faculty, which a lot of students wouldn't think about doing, and saying, I'm really interested. I see you're teaching a class on neuroscience. I'm going to be visiting. It would at all be possible for me to sit on your class. And I've had multiple professors be more than delighted that someone is that interested in what they're teaching and let them sit in.
That's definitely some good insight. Yeah, reaching out to individual professors is definitely something that I've done, and actually I have found very helpful, asking to schools I'm applying to especially. And then one last question here in the chat is asking about the MCAT and what exactly it covers and how students should prepare.
Okay, so the MCAT is typically an exam taken for students to be able to apply to medical school. Similarly, at the undergraduate level, like students oftentimes, particularly in the US, will take an SAT or an ACT. I mean, that can also be taken internationally to apply to college. For med school, a lot of times it's the MCAT. The MCAT covers really a lot of material, heavy in the sciences and quantitative reasoning, and they've changed the format a little bit. So now there's pieces on there about like psychology and social pieces as well. I would say that, frankly, if you are not yet in college, you're not really going to have the fundamental knowledge you need to be successful in studying for that. I mean, you can study for it to some extent, but my point is, I think your studying is more efficient and more effective when you've had the prerequisite courses, or the majority of them, at the college level that you need to apply to medical school anyways. One thing I will say is there's a few sites that do an MCAT question a day. So they'll email you an MCAT question, which I think is just an interesting thing that a lot of my students do, just to start to see what it's like. But I would say, in earnest, you're not probably going to be in your best state to prepare until you're actually an undergrad.
Okay, wonderful. Thank you so much for letting us have you on here today and speaking and giving all this great advice to everyone here today.
Okay, thank you very much.
Oops. Okay, so now I will just talk a little bit about myself and explain sort of where I came from and try to give any advice I have relative, especially to everything Alex shared here as well. I am a student. I've always been interested in medicine, particularly from my uncle. And actually, I've been fortunate enough to shadow him during summers and have that in-person experience, or the in-person hospital experience before COVID. So I will say, juxtaposing with what Alex said, in terms of leadership projects, I've actually managed to run a blood drive, and which is one of the examples she gave in her presentation. And actually, this Med Summit also would count as a leadership project. So these are definitely ideas if you are interested in trying to really appeal to the admissions officers at colleges to try to stand out as a candidate. Definitely going above and beyond, going the extra mile to run a healthcare workshop or to do a blood drive with the Red Cross and really make a real difference on a much larger scale is something that college admissions officers will really look for. And it's something that even beyond just the college process, I'm really proud to have done. And I'm glad to say, I think this has been a really meaningful experience, getting all the doctors, really coordinating all the doctors and everybody to come on here today. And I really couldn't have done it without all of you here as well. I have also had the experience, as I mentioned, I was able to shadow my uncle and who does surgeries. He does heart surgeries down in the DC area. He's a cardiologist, and he works in robotic surgery as well. And so I've been able to shadow him during surgeries, as well as I've also been able to work as a vet tech. Over the summer, I did before the summer secure a medical internship, but that was unfortunately canceled due to the pandemic. So I actually had to adapt and try to find another opportunity to get some more clinical experience. And I couldn't find anything in a hospital because the hospitals were very exclusionary to high school students this year. But I was able to find actually a opportunity to work as a veterinary technician. And that's definitely been a crucial part of my experience as well. And something that definitely, if you need extra clinical experience, and if you're having trouble finding a hospital for humans, that's something to consider as well, and an opportunity that I've been really grateful for and I think has been really meaningful, even though I'm not going into veterinary medicine. But it's definitely something that I think I can proudly say that I've done, even if it was just a backup plan. It's something that I think was very helpful in my clinical experience. And I'd also be happy to answer any questions here in the chat. And I see there are some as well, so I'll take a few questions just as we're wrapping up here. So there's a question in the chat where an individual asked, how do you find what class a professor teaches at a certain college? What I have done is I would check the website of the school you're looking at, and usually there's an area, a staff directory, there's a tab. It depends on the website, they vary a little bit, but there is these certain directories for each school, and you can find which teachers teach what classes or do what research there. We also have here asking about SATs and specifically what scores you might need to really excel as a pre-medical student. I can see Alex answered in the chat here. It varies depending on the school, but aiming for 1400 SAT or a 1400 or above for the SAT and a 30 or above ACT would be the goal if you really want to stand as a strong pre-medical student. We have any more questions in the chat here? I'll just give just a minute. Okay, wonderful. I'd like to just thank everybody for coming here today and for being present. And this has been a really meaningful experience for me, and I couldn't have done it without each and every one of you who attended and stuck the whole way through. A link will be sent out to everybody who attended today, and please feel free to share that link with everybody or with anybody else who might be interested in attending the webinar and who wasn't able to attend, or if you have a friend that you think might be interested in just rewatching it, we'll send that link to you and make that available to as many people as possible. We will also send out a resource guide as well, explaining some of the steps you can take specifically related to what Alex said as well, on finding those internships or reaching out to a professor or something as well. That will be sent out to everybody who participated. And also, again, feel free to share that with anybody else who was not able to make it today. And this will all happen hopefully tomorrow, or hopefully by tomorrow morning. So I would just like to say thank you very much again. If there are any more questions, I'll stay on for a few minutes. I see a bunch of thank yous in the chat to me. You're very welcome, guys.